Hello everyone, I am Dr. Sanjay Borude. I am a bariatric surgeon. I am attached with Bridge Candy, Jaslok, Hinduja, Apollo, Fortis and Reliance Hospital in Mumbai. I have been working in this particular field since past 21 years. These surgeries are given to all those morbidly obese patients. Generally, we operate patients after the puberty until the age of 70. There were some occasions in the past I had operated upon a 11 months old infant who she was morbidly obese, and the surgery, bariatric surgery on her in Rich Candy Hospital has proved life-saving procedure to her. She was operated in 2011. Today she is 12 years old and with good normal milestones. Because of that unique case, I am listed in Limca Book of Records as well. I had another occasion of performing a Google eye surgery that was Asia's first surgery in a morbidly obese patient. I am a professor emeritus in Mumbai's all the municipal hospitals where we conduct free surgeries. Friends, obesity is a excess accumulation of the fat in one's body. We have muscles, we have bones, we have fat, and we have water in our body. Everything should be under normal, but here the fat accumulation is excess, and that is called as morbid obesity. Now this excess collection of fat that leads to lot of hormonal, endocrinal and space occupying problems in human body. Now these endocrinal and hormonal problems, they lead to metabolic changes in any of that person. Generally speaking, obesity can be caused because of either exogenous or endogenous factors. Endogenous factors means the obese person will have either a genetic or a hormonal problem which we normally see in young children and adolescent obesity. While exogenous problems means their own lifestyle problem. They eat and consume more calories than required, and whatever excess calories that they have had, it is not burnt out by way of exercise. This leads to many metabolic issues to psychological issues. All these obese people, they are turned away by the society in various platforms, like in interviews, like in children suffer from in the school and in the society as well. While genetic and these hormonal problems lead to all metabolic diseases like diabetes, blood pressure, then sleep apnea and many cancers also. I have often been bombarded by a question, Doc, am I obese? So how do we grade our obesity? Generally, we grade obesity as mild, moderate and severe. Scientifically, we grade our obesity patients with excess weight but no comorbidities, that is complication. Patient with higher weight but with one complication, and third is patients with excess weight but many complications. So generally we categorize this obesity like that. Very simple formula, that is called as BMI. That is what is very commonly it is judged. Weight upon height in square meters is the one which gives us BMI. More than BMI, body composition analysis, that is a simple machine that tells us the quantity of the muscle mass, quantity of your bone mass, quantity of your fat mass, and the quantity of your water mass in one's body. People can have more of muscle mass and less of fat mass, that's considered normal. But whenever this ratio changes, when the muscle mass goes down and the fat mass increases, which is picked up by body composition analyzer, and that is the right way to judge anyone's obesity. Okay, it's a task, obesity management. Go anywhere in the world, the best treatment for obesity is diet and exercise. Diet, a calorie requirement can be varied with variable people. People, those who perform more physical work, will need more calories. It's vice versa. People, those who are sedentary, will not require those many calories. So one should be careful about the calorie intake, and even if you consume calories, how do they burn these calories out? Calorie burning is by way of exercise. Again, exercising should be dependent on person to person. If you are a moderate or severely obese person, you should always consult your doctor for the extent of exercise. One cannot start exercising one fine day and any kind of exercise. Similarly, the diet also should be properly monitored by your dietitian or a nutritionist. If person fails on diet and exercise program, but don't get nervous, we still have options like bariatric surgery. Though we call this as last resort, but it's a proven science over a period of last 60 years. Bariatric surgeries started in USA 60 years back. So, and we perform the best of the procedures today in Mumbai and all over the country now. So, bariatric surgeries means reducing the volume of the food that the person can accommodate and taking their appetite lower down. So it works in two ways: low appetite and low volume for consumption of calories and the food.